Dr. Anthony Fauci has just basically said, the sky is blue, but maybe it's green. Or something like that. That's probably not the best metaphor or analogy or whatever example. But you know, he came out. This was in an interview with Judy Woodruff on PBS NewsHour night before last night, I guess it was. And he said, "Here we are, the end of April." Excuse me, this is Judy Woodruff. She said, "Here we are, the end of April, the spring of 2022. How close are we to the end of this pandemic?" And Fauci said, "We are certainly right now in this country out of the pandemic phase." He said, namely, we don't have 900,000 new infections a day and tens and tens and tens of thousands of hospitalizations and thousands of deaths. We're at a very low level right now. And he went on to say that we need to keep that level very low and keep people vaccinated, that there's, I mean, basically he's saying we've got high levels of what you might call herd immunity, and we've got, you know, vaccination helping people out. And so, yeah, maybe it's not such a big deal anymore because so many people have immunity. At the same time, I personally, just speaking for myself, I am haunted by the author that we had on this program, maybe 2 months ago or so, who wrote the book about the flu pandemic that everybody says was the flu pandemic of 1918, 1919. Well, it turns out the flu pandemic lasted for 3 years. There was a fourth wave that happened in 1920, and more people died from that than died from the two previous ones. Well, that doesn't appear to be happening what's happening right now. People don't seem to be dying, although literally this morning on CNN they had a medical authority on, and he was saying, you know, we're at tens of thousands of new infections every day, and we are seeing in fact, there's been a 60% increase in new infections. And this is the infections that we know of because somebody got the PCR test, you know, got a swab shoved up to their brain. This does not count the fact that President Biden has sent free millions of home test kits to people. And so you've got millions and millions of people who are getting a sore throat or they're coughing or they're feeling like crap and they're doing their own test. And they're not calling up the public health department and saying, hey, I'm positive. I thought you'd want to know. Not happening. So, you know, the 60,000 new infections a day that we're looking at are just the official numbers. It appears to me that we are in a wave right now. If the official numbers are up 60% over the past 2 weeks, we saw the headline in the Oregonian yesterday was that here in Oregon we're up 50% over the previous 2 weeks. That's substantial. And what the guy on CNN this morning pointed out is that we are now starting to see a rise in hospitalizations. Now, that's the bad news. The good news is, I suppose, that the rise in hospitalizations is almost exclusively occurring among people who are unvaccinated or who were in such bad shape that the vaccine really didn't help them. It couldn't take effect. They were on immunosuppressive drugs, or they are battling cancer, or they're taking steroids. One of these conditions that basically causes vaccines not to work the way that they're supposed to. So on the one hand, you've got Dr. Fauci saying, yeah, everything's good, which it has become kind of the official mantra of the administration now, and has been, of course, the official mantra of the Republican Party for 2 years. And on the other hand, Dr. Fauci was invited by ABC News to come to the White House Correspondence dinner. When Louise and I lived in Washington, D.C., we were the guests of Ellen Ratner and Talk Radio News either 2 or 3 times to these dinners, to the White House Correspondence dinners. They are a hoot. And in fact, we were in the room the night that Donald Trump and that President Obama just, ridiculed Donald Trump. We were just, probably 50 feet away from Donald Trump and from Barack Obama, for that matter, as that was happening. And then, of course, later, just hours after that, Barack Obama went back to the White House Situation Room and oversaw the assassination of Osama bin Laden. I mean, it was a pretty big deal. which humiliated Donald Trump, and I think propelled him in part to challenge Hillary Clinton for the White House. But in any case, Anthony Fauci has so these White House Correspondents' dinners, when they happen, and we haven't had one for 2 years because of coronavirus. When they happen, they're a big deal. And being invited by a major news organization like ABC to sit at their table, I mean, this is big deal stuff. And Fauci, who had just said the pandemic is over, said, I'm not going to the Correspondents' dinner. He said, I did an individual assessment of my own personal risk, and I don't think it's a good idea to go. I mean, I'm paraphrasing, but the individual assessment of personal risk that's his language. In other words, he thinks he might get coronavirus. He might get COVID if he shows up at the Correspondents' dinner. He thinks that it might be a super spreader event. Well, if you're concerned that, like the Gridiron dinner was a couple of weeks ago, we've got all these, Nancy Pelosi, and now you've got the vice president has COVID. Again, that's the bad news. We're in this fourth wave. The good news is none of these people, seem to have gotten really seriously sick, other than just, having to quarantine for a couple of weeks. So how's the pandemic going where you live? I can tell you here in Portland increasingly, and I'm seeing this with friends, I'm seeing this with neighbors, people are getting very laissez-faire about it, very laid back about it, and oh yeah, okay, so I'll get sick, and I'll be, people are thinking of coronavirus, at least people who are double vaccinated and boosted, are thinking of coronavirus like it's going to be like the bad flu, which may well be the case. But if it is the case, why is Anthony Fauci not saying, "Oh yeah, sure, I'll go to the Correspondents' dinner and I'll probably get COVID and it won't be a big deal"? Is it because he's in his 70s? Well, does that mean that all of us in our 70s or anybody who is over 65 should have a whole different set of standards? So, anyway, I just wanted to share that with you and put it on the table as a point for conversation. I'll tell you how I feel about this. My own personal take on this is that I would prefer not to get COVID. I think that if I do get it, it's not going to be a big deal. I've gotten both boosters because I'm over 65, and I got both of the original shots. But I've known of people who got really, really sick from it, even though they were vaxxed and boosted. But I doubt it's going to kill me or disable me or cripple me. But I'd rather not get it. And so for the moment, I'm not going out because I see this wave happening. Louise and I went to a restaurant a couple days ago that was entirely outdoors. We were able to sit outside. We were able to sit, away from people. The servers wore masks. It was very respectful. And there's a number of restaurants here in Portland that are doing that, and that's comfortable for me. But eventually, the time is going to come when we're going to have to creep out into the world, and probably this summer. And we'll see how it shakes out. My brother, who died a month or so ago, there's a service for him in August, and we're thinking, okay, are we going to go to Michigan for this? I mean, the reality kind of intervenes.